Just to complete the image, this is a white blood cell, and this is actually a platelet as well. The echinocytes I need to point out to you because we encounter them very commonly. They are not generally not an abnormal or a pathologic thing that we worry about. There's a disease in the animal. There's something that we need to just recognize as, you know, it's an abnormality that happened in the tube. The echinocyte is in contrast to something that is pathologic. When we see this shape change, the acanthocyte, we do need to be concerned about something wrong going on in the patient. The echinocyte, which we were just looking at, and the acanthocyte are somewhat similar. They both have projections on the surface of the cells. But with acanthocytes, the projections are not uniformly distributed across the surface of the cell. They're all over the place. And the projections are of variable length. Acanthocytes can be seen with a variety of conditions. Important ones that you do need to remember. Sometimes we can see them when animals have liver disease. This is due to abnormal cholesterol metabolism that's present with liver disease. And that makes the membranes of the red cells also be abnormal. Another time when we can see them that's important to remember is various causes of red blood cell fragmentation in the bloodstream, called fragmentation hemolysis. Not a good thing. And a sign of it happening are these acanthocytes. Again, down here in the inset is normal for comparison, and this happens to be an electron micrograph, just so you can see in kind of a three-dimensional image what these spine-like projections are doing. So briefly, what is fragmentation hemolysis? Usually the anemia is mild or moderate, and sometimes the animals can even be walking around having this condition occurring and not even be clinically ill. Red blood cells are jam-packed into the blood vessels, as I showed in the video during class. They're very tightly packed and flying very rapidly through the bloodstream. Any little abnormality in the blood flow, for example, a piece of fibrin across the blood vessel or a heartworm in a blood vessel, will cause turbulent flow, catch up the red blood cells and kind of clothesline them and break them into little pieces, fragmenting these red blood cells. You can also have this occur when the surface of the blood vessels are not smooth. And examples of that are various types of endothelial injury, for example, a cancer of blood vessels called hemangiosarcoma, or when there's an inflammatory condition involving blood vessels called vasculitis. Instead of being a nice, smooth surface for those red cells to go flying by, on a microscopic basis, the inside lining of the blood vessel becomes very tortuous, creating turbulent flow, causing those red cells to tend to break up. So what's being shown here in this image is a normal red blood cell, and then some sort of problem that's causing fragmentation. I like to use the example of fibrin. When you have abnormal blood clots forming in the blood, for example, with disseminated intravascular coagulation, also called DIC, when you have abnormal strings of fibrin in the bloodstream, red cells are very easily caught up on that, broken into these small pieces that are called schistocytes. And sometimes within the circulation, these schistocytes reform into microspherocytes. I didn't stress microspherocytes in class because that's too complicated for right now. We're just going to stay focused on schistocytes and acanthocytes and keratocytes. So when this fragmentation is happening, as you can see on the next slide, we have abnormalities in the peripheral blood film in the shape of the red blood cells. So again, here's normal, our biconcave discs, our discocytes. And then here in this larger picture, we see relatively normal red blood cells. And then we have a few abnormal shapes. These are examples of schistocytes. We also have one with an abnormal color here, a polychromatophil. Here's another schistocyte as well. Down here in these lower inset images are something that's called keratocytes. They also occur with fragmentation. intravascular fragmentation hemolysis. And keratocytes sometimes are referred to as blister cells. I don't like that term. I usually use the doctor word and say keratocytes. But if you think of it as a blister cell, what's happening here is this kind of bubble is forming in the membrane. If that bubble ruptured, you'd end up with two little fragment-like projections sticking off the surface. So these are keratocytes, and they are examples, additional examples of abnormal shapes that can happen with fragmentation hemolysis. And we're going to revisit this idea numerous times, both during lecture and discussion in labs. Here is another example of an abnormal shape that can be seen with certain causes of hemolysis. We're looking at a peripheral blood film from a dog. This is a relatively normal red blood cell here, and what we're seeing are numerous spherocytes. And spherocytes are relatively spherical. They're round, and they lack the central pallor that a normal red cell would have. So they tend to kind of look a little darker, be very round. One must be cautious when trying to identify spherocytes and be sure that you're doing it in a species that we can confidently call them. In dogs, we can generally confidently call them because we can easily see that this is abnormal compared to the more normal cell. Remember though, cats and horses don't have much central pallor to begin with. And one of our criteria that we're using to identify the spherocyte is the lack of central pallor. It's kind of hard to identify lacking central pallor in a species that already doesn't have it to begin with. So we generally don't try to identify these in horses and cats. There are some exceptions, but in general, we don't try to identify these in horses and cats. When spherocytes are seen as in great a number as is in this slide, this is strongly suggestive of immune-mediated disease, immune-mediated hemolytic anemia. There are other conditions in which spherocytes might occur, and in those other conditions, the spherocytes are usually uncommon, very few, and not in every field. In this image, what I'm showing you are some erythrocyte ghosts. These are membrane remnants of lysed cells. These are empty bags of membrane. They used to be red blood cells. Complement that's been activated by the immune system into the membrane attack complex has punched holes in these membranes of these red cells, causing the contents to leak out into the bloodstream. And this has happened within the vasculature. So this is an example. When we see ghosts, we conclude that there is intravascular immune-mediated hemolysis going on. Also, for grins, I'll point out the schistocyte that's down here as well. Another example of abnormal shape, another poikilocyte type, is the eccentrocyte. It's helpful if we first look at the EM to understand what an eccentrocyte is. So let's focus here on this top left image. So this is electron photomicrograph of a red blood cell. And what's happened is there has been oxidative damage of the red blood cell membrane, lipid peroxidation specifically. The internal surfaces of the red blood cell membrane, so the inside aspect of the red blood cell membranes have fused, have stuck together on the inside. Because of that, the guts of the red cell have gotten squished to one side of the cell. So eccentrically placed, so eccentrocyte. If we looked at this cell in a peripheral blood film, it would be the ones to which I'm pointing now. You can see the little tag of fused membrane and then the guts of the red cell pushed off over to the side. Point to a few more here. Again, eccentrocytes are an example of red blood cell oxidative damage because the inside aspect of the membranes have fused to each other due to lipid peroxidation. Because red blood cell flow is very rapid and quick through the bloodstream, sometimes these little tags of cytoplasm, or excuse me, these little tags of fused membrane get ripped off in the very rapid, tortuous flow of the bloodstream. If this little tag got ripped off, you'd have a remnant, and that's what's down here in this lower part. This remnant has a douchey name, a pycnocyte. And here it is in the EM, and in this image, this is the pycnocyte here. I, for quizzing purposes, would never put an arrow on a pycnocyte and ask you to just ID it cold. I would, however, expect you to recognize the words eccentrocyte and pycnocyte together. If I wrote on a test and said the dog has eccentrocyte and pycnocytes, I would hope that you would know that means the dog has oxidative damage to his red cells. I will not ask you to ID pycnocytes cold. I do think it is fair game, though, to be able to recognize eccentrocytes. I think they're pretty easy to pick out with their little fused lip of membrane tag. Here's another image with numerous eccentrocytes to which I'm pointing now. This particular dog, in addition to having the abnormal shape, the eccentrocytes also had an abnormal inclusion, the Heinz body. So remember, when we're looking at red cells, we're looking at size, shape, color, and inclusions. The next several images I'm going to show you are examples of abnormal inclusions that happen for various different reasons, which we will go over during class. Here's another Heinz body here, and another one here. I believe they're a little bit easier to see in this image. What we're looking at side by side are blood films from the same animal. This one was stained with the regular stain, sort of like a diff quick stain, or other type of similar stain. And then this image was stained with new methylene blue. Remember, that's the stain we also use when we want to do reticulocyte counts. So looking at the normal stained image, we have our Heinz bodies, which are these nose-like projections on the surfaces of the cell. Occasionally, they also may occur as these paler circular regions in a cell. When this same blood is stained with new methylene blue, the Heinz bodies then stain kind of an aqua blue color, which jewels if we rock the fine focus, meaning it's refractile if we rock the fine focus. Heinz bodies represent oxidized, precipitated globin of the hemoglobin molecule. So the globin chain of the hemoglobin molecule becomes oxidized in the sulfhydryl groups, and they get cross-linked and they precipitate into these structures that I'm showing you here. So Heinz bodies are a sign, another type of sign for oxidative damage. Remember, in this class, there's a couple different H bodies that you do need to know. This is one of your H bodies. This is the Heinz body. It implies oxidative damage. There's another body, the Howell-Jolly body, which we should hopefully be coming to. Here is an example of another inclusion. Remember, we're looking at red cells. We look at size, shape, color, and inclusions. Here's an inclusion. This one happens to be a parasite, and this one is Mycoplasma haemophilus. For testing purposes, I will not ask you to identify infectious parasites or bugs at the genus species level. However, if I were to project an image like this, I would hope that you would recognize that there is an inclusion. There are inclusions, let's say, in all these red cells, and that it's a bug. So be able to feel pretty confident up to the level of that's a bug and be able to pick it from a multiple choice question. So what we're looking at here are red blood cells doing rouleau, that stack of coin-like appearance. And I like to focus in the image on this one because the cell is relatively individualized, so is this one. But this one, we can see these little ring-like structures. Mycoplasma haemophilus is an epicellular parasite, meaning it sits on the surface of the membrane. It forms ring-like structures, rods, or cocci, so it's variable in shape, pleomorphic. And you'll see it in the ring forms or in a chain of dots on the surface of the cell, for example. This is Mycoplasma haemocanus. formerly Hemabartonella canis. And what we have here are a few red cells with inclusions in them. I like this one in particular. You see the long chain of cocci form. So I would want you to be able to recognize abnormal inclusion. It's a bug. Here's another example of an abnormal inclusion. That's a bug. This happens to be a peripheral blood film from a cat. And what we're looking at here are numerous signet ring-shaped inclusions of cytoxone thelyss. You will eventually learn all about cytoxone. It's an important disease to know about, especially in certain geographic areas, and it can actually kill